Sorry, there's so much stuff everywhere. We're just moving in. But anyways, this is Thomas Turner with my Neuro Assessment. I'm gonna prop the camera up. Oh, that is not a good angle here. Okay. So I'm gonna prop the camera up. I'll slide it back a little bit. And I will be doing my neuro assessment on my patient, Miss Lane here. Alright, so I'm just gonna sit on the couch beside her so that way I'm in frame here. But my patient, obviously, before I come in, I would do my safety practices, verify the order, gather my supplies, check policy and procedure, head to the room, introduce myself, note their condition, provide for privacy, let them know what I'll be doing, perform it, don PPE if necessary, raise the bed for good body mechanics and return it back whenever I've finished, and report any abnormal findings to the nurse. So I'm going to be doing a focused neuro assessment on my patient here. So she reports some sort of injury of some sort, and I'm just going to be checking her neuro status. And I'll start off by walking in the room and just noting her general appearance. She's sitting upright, doesn't look disheveled or anything like that. Seems to be pretty with it. I would note her level of consciousness by asking her, why is she here? Does she know where she at? What month is it? Things of that nature. And I would ask her a couple questions like, what would you do if you saw a garbage can on fire?
Probably call the fire department.
Okay.
Or
So
try to put it out.
that's a reasonable answer, what most people would do. Nothing crazy. She's not saying she'd go grab a ham or anything, so that's good. So we got most of the questions out of the way. I would get her vital signs and everything, and I'm going to get a manual BP for the purpose of the video. So I'll do that now. Alright, so her blood pressure was 130/82. Not too bad, within normal limits. So, as far as my vital signs are concerned, she's also looking pretty good. Everything's pretty normal. So I have my questions out of the way, have my vital signs, and I'm gonna go past the cranial nerves part. I'll save that for last. And this is when I would assess her patellar reflex, and I would have her sit on the edge of a table. We're on the side of a couch, so it's not gonna work all that good. But I would just kind of find the dip in her knee, below the kneecap, and then just, hit and see if her leg moves. Obviously, like I said, on the edge of the couch, it's a little harder, so I'm not going to sit here and just keep hitting her with the hammer. But, yeah, so there is the patella reflex. I have my level of consciousness, critical thinking skills, general appearance. So now I can do the cranial nerves. So the first test, I knew I forgot something. Okay, so we're just going to pretend that this is some peppermint. And we would have her close her eyes. I will occlude one nostril, and I'll have her sniff. And she'll be like, oh, that's peppermint. And then I'll bring something else in, such as like vanilla, oranges, coffee, something easily identifiable, alcohol swab, something close by. And then I'll include the other nostril, have her sniff, tell me what it is. Okay, so once that's done, that is the olfactory nerve number 1. So that's been tested. She smelled both of them correctly. No problems with either side, so we can move on to the second one, which is the optic nerve number 2. So I would have her close one eye and tell me how many fingers I have up.
2,
All right, close the other. How many fingers do I have up?
3.
Okay, so both eyes are working properly on both sides, and that is the second nerve. So the third, fourth, and sixth can all be tested together. Those are your abductus, trochlear, and oculomotor. And you can test those by starting off with, Perla, making sure the eyes are equal and reactive to light. So, yeah, that one was reactive. So was that one. Okay. And then I test that would be like 3, I believe. And then 4 and 6, I would test by, you can make like a box, have her follow without moving her head. Make like a box. And then do follow again. Like an X, and you can test all of the directions, up, down, left, right, and then the diagonal directions as well. There was no sort of sluggish movement. Both sides were equal and reactive to the light. So that is 3, 4, and 6, and she passed those. So we will move to number 5. Kind of going back here a little bit. That is the trigeminal. So there's 3 things that I need to test here. The first one is I will have her chew, and I will just feel her muscles on the mandible and the temple. And both of them were, the muscles were flexing equally and on both sides. If I had a cotton ball here, which I don't, we would just pretend that this is. I have her close her eyes. And then I would gently rub her forehead, and she'd tell me, then her cheeks, and then her chin. And she'd tell me when she feels it. Obviously, I'd be a little more prepared than I am right now. Just forgot a few materials, that's okay. And then I will have her clench her jaw together. And I'll just push down on her chin. And since it cannot separate, that's a good finding. If they can, that is representing that they have loss of some of the muscle function in their jaw. So she passed all those. That's good. That is all 3 parts of the trigeminal nerve, cranial nerve number 5. So we already did 6 with the vision tests and all the cardinal directions. So 7 will be the facial nerve, and that's where I'll have her make a bunch of different faces at me. So can you smile, frown, puff out your cheeks? All right. So she puffed out her cheeks. I believe I missed one part. Puff out your cheeks again. All right. And then I'm just going to push the air out, and they should come out equally. All right. It worked. I was a little aggressive there. But, yeah, so everything works out fine. Everything was equal. No sort of drooping on one side or weakness on one side. Next would be the 8th cranial nerve, which is the acoustic, and I would come from her side and just be like, whisper a phrase like, how are you? Something like that. Something that is easily discernible, and I'll just whisper from far away. Like, okay, and she can hear me from far away, and since I started at such a distance, I wouldn't have to move closer, but with your older patients or somebody that has some hearing issues, you might have to slowly get closer and closer to test where they can actually pick up those low volume sounds. So that was the 8th one. So the glossopharyngeal and the vagus are your 9th and 10th nerves, and the 9th one is a little bit harder to test. It's 1/3 of your taste, I believe, in the back of your tongue. But the best way to assess this would to take like a tongue blade. I don't think I have one. Sorry, I literally didn't bring anything, but I'll just represent it like this. I'm not actually going to put it in her mouth, but. So I would just have her say ah, and, would note that the back of her throat is moving equally. And then I would test our gag reflex with the tongue blade, but obviously I'm not going to put that in her mouth. So we're just going to assume that she would have responded appropriately to that. So that was 9 and 10, and 11 would be the spinal accessory nerve. So I would just have her kind of rotate her head around in a circle like that and shrug your shoulders. All right, yeah, so everything looks fine there. That was the spinal accessory, the 11th one. The last one, the 12th nerve, that is the hypoglossal. Sorry, my dogs are all over the place. The hypoglossal. So the way that I would test that is that's like your tongue muscles. So I would have her stick her tongue at me, and I would note folds in the tongue, and that, it looks flexed on all sides and there's not any sort of unilateral weakness. And then I would have her say the phrase light, night, and dynamite.
Light, night, dynamite.
And I would just listen to the L's, N's, D's, and T's in there, and just make sure there's no problems with saying her words properly. And there was no problems with that. So that was all the 12 cranial nerves. And now I need to assess her on the Glasgow Coma Scale, which I have been doing throughout the process, assessing how she responds, and she can follow my commands. She's alert and oriented, eyes are open, and she's awake and oriented and observing me. And whenever she speaks, there's no sort of problems with pronunciation or getting the words out or with her sort of cognition. So I would rate her as a perfect 20 on the Glasgow Coma scale, and I would just report anything that I find that's abnormal and make sure that I document all this. And I believe that's everything. Let me run it through in my head. So, level of consciousness, all the questions, the reflex, Glasgow Coma Scale, all 12 cranial nerves, and the blood pressure. Yeah, so I believe that's everything. So our patient seems to be fine here, looking good, and we can go ahead and send her back to whatever floor she was on.